One of my big passions is full facial rejuvenation. And in order to rejuvenate a face in the best way I know how, I use a technique called the deep plane facelift. This is a technique that has been around since the 1980s when our understanding of the anatomy of the face changed. And we realized that it wasn't the skin and it wasn't fat that contributed to facial aging. It really was a layer underneath the skin called the smaz in the face or the platysma in the neck that started to descend down with time. And it's not that that muscle is getting weaker or falling down faster. It's actually that the ligaments of the face that are responsible for holding it up become a little bit more loose, and as a result, that tissue slides downwards. And so it creates several problem areas for many of our patients, the most common being the nasolabial folds, the jowls, as well as banding in the neck. And so I use my training both in head and neck surgery and facial cosmetic surgery to enhance what has been descended over time, but also to really provide a jawline or neck that patients have never had any time in their lives before. So I combine the deep neck lift as well as the deep plane facelift to restore a face in a more vertical fashion, as well as create a hammock underneath the neck to create a jawline that they may have never had before. And in doing so, we're able to add other procedures like a brow lift, eyelid surgery, lip lift surgery, facial fat grafting, as well as laser to the entire face in order to create a much more holistic approach to facial rejuvenation. The deep plane facelift is different than standard facelift surgery because it doesn't just work on the face and it doesn't just tighten the muscle in a very lateral aspect. The deep plane surgery goes to the issues that people are complaining of, which is the nasolabial fold, the jowl, and the platysmal banding. And so by going underneath that muscle responsible for aging, we're able to release the face in those exact areas of concern in order to maximize the vector of the pull. And so this allows me to release ligaments, and we liken it to a hotel making your bed in the morning. In order to get a beautiful redrape of that sheet, they have to lift it up all the way. And that's very different than a teenager making your bed in the morning, taking the sheets and just popping them on top of the pillows. They still look like a made bed. However, there's a dramatic difference between the two because the one made by the hotel looks much more natural. It's clean from the toe of the bed to the head of the bed. And when we draw our parallels to deep plane surgery versus old school smaz surgery, we get much more natural results. People look much less windswept. And it also allows us to create longevity and durability to the lift because we are now releasing those ligaments and that gravity that's responsible for facial aging in the future.